Good afternoon, everyone. Thank you for joining. We'll just pause for a few moments to let additional folks join. Hello, everyone. Thank you for joining again. We'll just pause for a minute more as people continue to roll in. Appreciate it. All right, I think we can get started. Good afternoon, and thank you for joining the ONC Health IT Certification Program Developer Roundtable. My name is Lindsay Lewinsky, and I'm with Chickasaw Nation Industries. Our team will be providing technical assistance for today's session. If you have any technical support, please type your issue into the Q&A box, and one of our team members will assist you. Please be aware that today's session will be recorded. Closed captioning is also available by clicking the closed captioning icon at the bottom of your screen. Any questions you may have during the presentation can be placed in the Q&A box and will be addressed in writing during the presentation, and any remaining questions we encourage you to submit to our feedback portal, which will be linked at the end of the presentation. Slides from today's session will be made publicly available. With that, Jeff, I'll turn it over to you.
All right. Thank you, Lindsay. And good afternoon, everyone on the East Coast. Good morning to those of you in points west. We've got the obligatory note here. What we're going to go through today is at a high level, a bunch of activities that we're engaged in and a bunch of efforts that we would like this community to know about. But we should note that these slides are not official program requirements, don't represent the law. You need to go to the actual Code of Federal Regulations for that. And please note that these slides have been produced and will be disseminated at the U.S. taxpayer expense. Slide. Okay, so for those of you who don't know me, my name is Jeff Smith, and I am the acting director for the Certification and Testing Division here at ASTP/ONC. We're going to go through a number of certification program updates that have occurred in the last couple of months. We're going to talk a little bit about high priority for this administration and our office regarding prior authorization and kind of what's going on this year. And then my colleague Scott Bohan is going to talk about Inferno, which is our test tool that is intended to test API-based software. Next slide, please. All right, one more. Okay, so for those of you who made the trek to DC for our annual meeting, thank you. I hope that you had a good time. I heard from a lot of folks that it was a tremendous set of sessions and a lot of meaningful engagement. If you didn't make it to the annual meeting, we have a bunch of stuff available on our website. We have recordings and we have slides from breakout sessions. You know, I think this is an annual affair that was kind of scheduled at a different time of the year than usual. But it was a really good showing, and we had a lot of, I think, really good interactions and had a lot of really good discussions. So if you want to relive the glory, you can go watch those recordings and look at those slides. And certainly if you'd missed it, I would highly encourage you to go check it out, especially the breakout session slides. There was a lot of really good content, as there always is. Next slide, please. Okay, so you all have been just gone through a very busy time. This slide depicts all of the certification criteria that needed to be updated by the beginning of this year. Mostly, I would say, stemming from the HTI-1 final rule. I think you all should be commended, and generally the industry should be commended. I want to say we're still tabulating things, but north of, I would say, 97, 99, 98% of all modules that needed to be updated to these new criteria made it in on time. And I know that it's a tremendous amount of work for you as well as for your certification bodies and testing labs. So, I want to say thank you for that. Obviously there was the appropriations lapse at the end of last fiscal year. And I think that the extra time we were able to afford developers was very useful, at least by our numbers. We had a fairly low number of folks that were going to make it in by January 1st. And the gap that we made up was pretty impressive. So I want to say thank you for all of that. If you happen to be a developer who has yet to make those updates, and there are a few, I would encourage you to go ahead and try and make those updates as soon as possible. You don't really want to have a knock on your door from us. And also you want to make sure that your clients, your provider users, are in a good position to leverage certified technology for whatever kind of programs, CMS and otherwise, they may need to use Cert for. All right, next slide. The annual cadence of the US Core Data for Interoperability is underway. We actually, at the end of January, was able to draft US CDI version 7. It's kind of hard to believe that we're already in version 7, but there are 30 overall proposed data element additions across numerous data classes that are really meant to strengthen support for patient safety, nutrition care, and administrative burden reduction. And this is all well in alignment with the Make America Healthy Again emphasis of this administration. I will note that we are taking feedback until April 13th. And if you go to the next slide, got a screen grab of those new data elements, and you can see where some of those new data elements and a new data class kind of exists. Again, we will be accepting new data element submissions through OnDeck. Those of you who are familiar with OnDeck should have no trouble kind of navigating it. If you're not familiar with OnDeck, you might want to give yourself a little bit of time to become more familiar with it. And again, we're going to be taking comment submissions on these data elements as well as new data elements that you think should warrant future consideration until April the 13th. Okay, next slide. Okay, HTI 5. I, again, thank many of you. I think we're still kind of tabulating, but I think we had over 300 submissions. There was a funny quirk with the Federal Register, which made it look like we had 7,000 submissions. Probably I can get into that on a different day. But I really think I want to say thank you to those of you who submitted comments, either personally or on behalf of your organization or on behalf of your association. We really did throw a lot into the proposals. Much of the program was proposed to be removed, or aspects of certain criteria revised. And I think it's important to note that the regulatory process really is a conversation between things that we think we know we want to do and things that we are interested in getting feedback on, and then listening to you all. So we are going to take all of the comments that we received and we will be considering them and responding to them. And then we are looking to finalize a rule. It's always tricky. There's a lot of moving parts, but we're hoping anyway to finalize something closer to the middle end of summer. These things take time, but I think a lot of what we were hoping to do is reduce burden on developers in ways that made sense. And I think it's always a question of, if you remove the training wheels, will the bike still continue to roll down the hill? I think we tried to take a educated assessment of whether or not certain functionalities could no longer be certified under the program, but still be widely deployed and available for customers. But I think that that's an area where we wanted a lot of feedback, and I know that's an area that we got a lot of feedback. And I will say, just kind of as a final piece on HTI 5, we really tried to kind of think about how do we orient the certification for future directions. And so while this rule taketh away, there may be possibilities for future proposals. And I think certainly we inside the government understand that taking all of this away without having completed the turn to modernize the program would not be ideal. So anyway, thank you for your comments. If you missed the boat on HTI 5 and don't know what it is, we have some hyperlinks in the slides. And again, these slides should be available sometime next week. We have to get it through the clearance process. But we've got a lot of information available on the healthit.gov website. Next slide. Okay, a couple of other things. We've got one live request for information on diagnostic imaging, and we have a just closed request for information on health sector use of AI. I think both of these are requests for information oftentimes are windows into areas that we're kind of looking at and thinking about from a policy perspective. But I will underscore that requests for information don't necessarily result in any real action being taken. I think we have for a while been trying to figure out how to improve the interoperability of diagnostic images. There are some pockets of the country that have really decent access to images, both patient access as well as kind of referring or transferring clinical access. But much of the country continues to struggle. And so this is something that we're interested in. The comment period is open until March of the 16th. And as far as the health sector AI RFI is concerned, that has closed, but we ended up getting a good amount of comments from a wide array of commenters. So again, thank you. If you took the time to send us your thoughts, we were looking for input on regulation, reimbursement, and then research and development activities that we should be considering. And I think this RFI again should be taken as a signal that this is an area that we're looking to get up to speed on, so that we understand the challenges and the barriers, and that we can look at the instrumentation across the department to try and address some of those challenges and barriers. Okay, next slide, please. This is a friendly reminder that the attestation period will begin April 1st and open through April 30th. Hopefully, the attestation period, if the attestation process, as it pertains to you, is somewhat old hat at this point. But certainly, if you have any questions, you should contact your ACB directly. And we also have an attestations resource guide. All right, next slide. Okay, real world testing results for 2025. A couple things here. The kind of annual cadence of real world testing plan submission and results submission has been somewhat modified this year. We still have a requirement that testing results for 2025 need to be made public by March 15th. And I believe ACBs have established an expectation and set of deadlines to kind of make this deadline work. I will say the enforcement discretion here, I'll just highlight specifically for calendar year 2025, developers, you are not expected to submit a real world testing plan for 2026. If you did, that's completely fine. If you still want to put your testing plan up on the website for 2026, that's completely fine too. Nothing wrong with that. As for 2026 though, the enforcement discretion that we put out last year basically says that we only expect a developer with a health IT module certified to our G criteria, G7 through 10. As of August 31st, 2024, we'll submit 2025 real world testing results to their ACB by this March. So again, if you have a real world testing results that are more inclusive than G7 through G10, you are welcome to submit that fully to the ACB, and you're welcome to, make that available on your website. There's just no requirement to do so. I will note that the enforcement discretion will remain in effect through December of this year, or until we complete deregulatory action to revise these requirements, whichever comes first. Okay, next slide, please. All right, I think this is going to be the last of the smattering of updates. The standards version advancement process is a process that really never stops. It never ends. We are currently accepting comments for the 2026 SVAP cycle. We've got a handful of standards that we have put up for folks to look at, and there may be standards that we end up finalizing that aren't there. Generally, this process tries to find standards and agreement with industry on standards that are newer, better, faster, stronger than the standards that we have in regulation, and that allows developers who are currently certified to a specific criterion to use that newer standard version. It also allows developers who are new to the program or with a product that is newly kind of looking to get certified to a criterion, it allows them to use that newer standard to be certified as opposed to the older one. So this is, again, kind of a ripe time to provide us your thoughts. And I think consistent with years past, we're going to try and finalize the 2026 SVAP standards sometime this summer, June, July. And those will then be part of the program and available for use. All right, next slide. Okay. All right, so we've got a handful of slides here on prior authorization, and I want to preface all of this is a lot of this content came from the HTI 4 final rule. We've got some additional content that we'll try and emphasize, but at a really high level, prior authorization has become one of, if not the emphasis point for the administration and for HHS, kind of up and down the chain. And, I think that is good news for us because we have been thinking and trying to raise this up the priority chain for a number of years, as I know many of you have been. I will say that we are coordinating very closely with our partners at CMS on this. When you take a step back and you look at the intersection of CMS policy and ASTP ONC policy, you see no fewer than kind of four spinning plates at the end of sticks. And so we're doing our best to make sure that we're aligned and that we're coordinated, and that policies we have established or will establish in the future are consistent and smooth and heading in the same direction. I don't think it would, I think the benefits of prior authorization are well understood by this group, as is the complexity. And, I think one of the challenges we have is navigating that complexity, both technically and socio-technically. But we are marching in that direction with certification program requirements. Okay, next slide. Let's get into it. Okay, so we adopted 3 new certification criteria through HTI 4, and that's 170.315G 31 through 33. Sorry about that, little typo. And we really did it to support more efficient management of electronic prior authorization and reduce administrative burden through the use of standards. And those standards are the FHIR implementation guides that have been developed and authored by HL7's Da Vinci project. Specifically, we've got provider prior authorization API coverage requirements discovery. We've got a criterion focused on documentation templates and rules, and we have a criterion on prior authorization support. So I think what's really kind of important here is that the interactions between actors, the interactions between those who are engaging in prior authorization, it's a two-sided conversation between provider systems and payer systems. Our certification criteria pertain at this point only to provider systems. And, again, we're working with our colleagues at CMS to ensure that payers and providers are on the same page when it comes to some of these requirements. But I think it's equally important, again, to kind of recognize that we've got 3 different modules that are meant to work in tandem. They're meant to address certain aspects of the prior auth transaction set. And, we are doing our best to work with industry and to work with the standards development community to understand some of the kind of current and ongoing challenges. I think we can, we'll go to the next slide. Okay, so we also finalized in HTI 4 modular API criteria. We had proposed a lot of modular API criteria in HTI 2. And the 2 that came out of that, and what we finalized in HTI 4 were the workflow triggers for decision support interventions on the client side, which is the provider end, and subscriptions on the client side. And, I guess a couple things, in HTI 2, we talked about trying to take a different tact to how we thought about the certification of API functionality. And, so we took some time to kind of deconstruct G10 into various J criteria. And we also used the J criteria to introduce new functionalities like CDS hooks and subscriptions. And, so I think this should be taken as a signal that we're still very interested in what the possibilities are for these kind of standardized interactions and workflows. Obviously, the CDS hooks provides kind of a framework for decision support, and subscriptions enables users to be proactively notified of an event or data update. And within the context of the certification program, we are only setting expectations very narrowly for the use of CDS hooks and subscriptions within the context of prior authorization. But I think it's it stands to reason that if you can support CDS hooks and subscriptions for prior authorization, maybe there's other areas that you should be thinking about also supporting that are not necessarily under the certification requirement, but maybe one day will be. So if we go to the next slide, this is kind of how the two come together. So I will note that obviously the G31 through 33 cross-reference the J criteria. And I want to make sure that folks understand they don't have to get separately certified to J and G criteria. If a developer wanted to get certified standalone for CDS hooks and subscriptions, they could. But we want to kind of clarify that when a developer gets certified to G31, and as a function of that is supporting J20, they don't need to kind of separately certify to J20. We had some questions in previous, I think, presentations that were kind of confused by that, worried by that. And I want to make sure that folks kind of truly understand at this point. You're able to get certified to the G criterion and then more or less get credit for the J criterion. All right. Next. A word on kind of non-standard functionality expectations within the within the criterion, and that is on technical documentation. I think if you look at the technical documentation requirements for G10, the standardized API for patient and population level services, you'll notice similarities in terms of both the wording and the intent. Really what we are requiring is that complete technical documentation is available, and that includes API syntax, function names, required and optional parameters, as well as software components and configurations that would be necessary for an application to implement in order to be able to successfully interact with the API and the process its responses. Again, for those of you who are aware of and certified to G10, the requirements here for G31 and 33 are the same. All right, next slide. Okay, just a couple more before the Jeff Smith show is over. There's a lot going on in this slide, but I think what we want to try and convey here are a couple of things. We do not, at this point, have certification program dictated deadlines for these criteria. However, if you're a developer and you have clients who are in one or both of the, well, there's actually multiple, never mind, I shouldn't say one or both, but if you have clients who are enrolled in one of the Medicare incentive programs, good examples being the Promoting Interoperability Program for hospitals and MIPS for clinicians, you will want to be able to support your clients by a specific date. Currently, there are requirements on the books for providers to use data from certified technology in 2027 to engage in at least one prior authorization. And I am paraphrasing the exact measure, so you're going to want to go look at that at CMS, at CMS's website. But I think it's important to highlight that as an example of the way in which two policies can be coming from two different agencies, yet interlock in a way that's mutually supportive. So we don't have a requirement in our program to be certified to these new criteria by a specific date, but CMS has expectations that providers have access and use said technology by a specific date. Obviously, we've got some dependencies here. I won't go through all of that, but it is important to note that getting certified to G31 also means understanding requirements in other aspects of the program. There are no new privacy and security criteria requirements for these 3G criteria. We just talked about the documentation requirements and how those are meant to be very similar to what's at G10. And then last but not least, I know that Inferno as a test tool, and if you're not familiar with Inferno, you will be here in a couple slides, is top of mind for everybody. We've gotten several questions regarding the availability of test kits. And what I want to kind of provide here as an update is that we are working to develop test kits that would allow developers to demonstrate conformance to specific Da Vinci guides related to prior authorization. So and I apologize for the shorthand here, but for the Da Vinci CRD, DTR, and PAS implementation guides, we are developing test kits for those. We are specifically focusing test kit development on version 2.2.0, and that would be for provider systems only at this point. So kind of recalling the earlier conversation about how there's two sides of the exchange, we're developing test kits for the implementation guides, and we're really hoping to have those test kits available for early testing sometime in March. And we're hoping to have final test kits for those implementation guides sometime in June. And I think there's a Connectathon that is going to be happening around that time. So we're really trying to get things ready by that date. All of this, of course, is subject to the vagaries of government mechanics and potential things that are outside of our control, but we are trying to get these test kits out there and available. And I would say, just as a follow-on, that the implementation guide test kits are not necessarily going to be the certification criterion test kits. Those will be, something that we work on after the fact, and those will be complementary to. So we're not looking to, we're certainly not looking to have different requirements between the two. So at any rate, I believe now we've got one more slide. So just one more slide, and then I can hand things over to Scott. Okay, last but certainly not least, API conditions and maintenance of certification requirements were updated in HTI 4. And, I think we tried to take a sensible approach to updating the API condition and maintenance of certification requirements. Again, if you're certified to G10, you have to do basically the same stuff. You have to follow the general requirements of the condition, the transparency, fees, and openness and pro-competitive conditions for G criteria at G31, 32, and 33. And then on the maintenance of certification requirements, we have authentication, verification, and registration for production use requirements, and those only pertain to G31 and 33. So I know that was a lot to take in at a pretty high level. Know that, again, prior authorization is a huge emphasis for this administration. It's a top priority for us and our colleagues over at CMS. You will no doubt be hearing a lot more from us about these criteria and about program updates, and we will also be very interested in hearing from you. And so just kind of expect a lot of emphasis on this stuff over the next handful of months. Okay. With that, Scott, I will go ahead and yield the floor.
All right, thank you, Jeff. Hello, everyone. This is Scott Bohan from the ASTP ONC Tools and Testing Branch, and I will be discussing some of the foundational concepts and resources that are available for the Inferno Fire testing tool. So we can go to the next slide. Right, to start the presentation, I will provide some context around fire testing. And what is on this slide is one way to think about fire testing and illustrating some pieces of the testing workflow at a conceptual level. So on the left-hand side of the slide here at step one is where we start with the requirements. And these requirements overall are established by the intended use case, and in a technical sense, usually come from fire implementation guides, or referred to as IGs for short. And fire IGs can contain the specifications that a system needs to conform to at a technical level. So then moving on to step two are the conformance artifacts that serve as a benchmark or a reference point. And these artifacts can include things like a reference server, which is an implementation of the requirements. And this server can be a reference point for other systems that are trying to meet conformance to those requirements. Next are reference data. And a reference server is often populated with reference data, which is data conformant to the requirements. And then third are the conformance tests, which are used by a testing tool to check a system's conformance to the requirements. And a testing tool such as Inferno may contain all of these testing artifacts. And then moving on to step three here, a system under test can use a test tool like Inferno to verify conformance to those set requirements using the available tests. And while testing tools may not cover every possible test case, they may test common pathways and scenarios to provide a general idea of a system's conformance to the set requirements. And then last here is step four. The results of a test tool are output and then can be checked for various purposes, like certification program conformance, or as part of a systems development cycle to uncover things like software bugs and unexpected behaviors. Next slide. Okay, so then this slide provides an overview of some of the key points regarding the Inferno testing tool specifically. So what is Inferno? So first, Inferno is an open source tool for creating conformance tests for the fire standard. Inferno is capable of supporting tests for a variety of use cases, one of which is the ONC certification program. So Inferno provides the testing infrastructure for the official certification program testing tool for the G10 standardized API for patient and population services certification criterion. And the G10 criterion defines requirements for a single patient API and multi-patient API according to the FHIR standard, FHIR implementation guides, and other standards. And Inferno provides support for the testing of the single patient API and multi-patient API for the G10 criterion. In addition to supporting ONC certification program in an official capacity, Inferno is also a platform for general fire testing. And Inferno can be used by health IT developers in their software development cycles to help verify their implementation conformance to FHIR. And additionally, Inferno can also help facilitate the advancement of implementation guides. So IG authors can use Inferno to verify implementation of the IGs in practice, such as through testing reference implementations, like a reference server. And there's also many Inferno test kits supporting FHIR IGs, such as US Core, DaVinci Burden Reduction for prior authorization support, and many more use cases. Also note that Inferno is designed to be flexible in how users can interact with the testing tool. Inferno supports a graphical user interface as well as an API for programmatic and automated testing. And then last, I'll note that Inferno is designed to be transparent and open source. And this means that the Inferno framework source code is available online and benefits from community review and feedback, and includes documentation to enable Inferno testing to be adapted for other use cases by the community. Next slide. Okay, so going into a little bit more detail, the technical structure of Inferno, or the technical infrastructure rather of Inferno is the Inferno framework. The Inferno framework is a collection of capabilities that enables writing tests for the fire standard as well as other standards and specifications. And there's two main components of the Inferno framework I want to highlight. First is that Inferno is powered by a programming language tailored specifically to make authoring fire tests easier. And this is referred to as the Inferno domain-specific language. And this language reduces the burden of writing and maintaining the testing infrastructure for fire tests in Inferno. And then second is that Inferno tests are designed to be accessible. And the Inferno framework enables many ways of interacting with the testing environment, with testing interfaces available through web, API, and command line interfaces. And then both of these capabilities and more are enabled by using the Ruby programming language. And using Ruby empowers Inferno with all the capabilities and flexibilities provided by a fully featured programming language. Next slide. Okay, so we went over that Inferno framework enables writing tests for fire conformance, but tests are only one component that's involved in fire testing. And rigorous fire implementation guide testing may include use of fire profile and terminology validation. You could also include reference to reference servers, clients, and data, and a number of other different types of services that may be relevant for testing the use case. And to account for this, Inferno's testing approach is to package specific testing use cases into what we call test kits. And Inferno test kits are a collection of the tests and facilitating services and utilities that are used to test a specific use case. So for example, if we consider the test kit used for the ONC certification program for the G10 criterion, that test kit involves things such as profile validation and terminology validation services, alongside other API tests as part of testing that single patient and multi-patient API required by the criterion. There's also a reference server that is available, which provides an example of what a conformance server could look like for the G10 criterion. So Inferno enables such test kits like the G10 test kit to be deployed either locally or online. And ASTP ONC hosts an instance of Inferno with many test kits available at inferno.healthit.gov. And additionally, I'll note that there are instructions for deploying an Inferno test kit locally, which may be included in a test kit's GitHub repository. Next slide. Okay, so then going into just some examples of the Inferno test kits that are available. Specifically for this slide, we have grouped here the Inferno test kits for the DaVinci project. And these test kits are available online at inferno.healthit.gov. And also the source code is available on GitHub for local download. Just to provide a quick overview of some of the versions that are available for these implementation guide tests. For the burden reduction DaVinci test kits, we have for CRD, DTR, and PAS. We have test kits available for version 2.0.1 of those specifications currently available. And then some of the other DaVinci IGs that are available include PDEX version 2, US Drug Formulary version 2.0.1, and PlanNet version 1.1. Next slide. Okay, so then beyond the DaVinci Inferno test kits, this is some of the other test kits that are available in the Inferno framework. So we have things like the G10 criterion, service-based URL test kit, US core test kit as some of the test kits that are available online, as well as for local download. And there's many more available listed on this slide, and as well as in the Inferno test kit registry. And that registry lists some of the Inferno test kits that are available in more detail. And a link to that registry is available using the link available on the slide. Next slide. Okay, and then this slide is a quick reference as far as answering some frequently asked questions and some links to some resources that are available. So in general, if you're unsure of where to start with learning about Inferno and getting some more information there around, what Inferno is, inferno.healthit.gov is a resource that is ASTP ONC's hosted instance where we have testing available for many of the test kits that I just went over, as well as links to resources where you can learn more about Inferno. So that is a place to start if you want to just are unsure of where to go, and that's available as a starting point. As I mentioned previously, there's also a test kit registry, which is linked in this slide that lists in detail some of the Inferno test kits that are available. So that could be a resource for that. For certification program focused Inferno testing, we have the ONC GitHub, and there are repositories in the ONC GitHub organization that are available if you want to see the source code that's involved with certification program tests. And then as far as voluntary and self-assessment goes, these are things that could help with developing a system for voluntary self-assessment. There is an Inferno framework organization that includes repositories, and this includes a lot of our Fire IG test kits such as US Core, the DaVinci IGs, and others. They're available in that Inferno framework organization. And then if you are interested in learning about some of the technologies that are underlying the Inferno framework, and if you're interested in writing your own tests and deploying your own tests, the Inferno framework documentation is a detailed resource that goes over those concepts and more, and that is available in this slide. And then if there are specific questions around an Inferno test kit, one way to ask your question, if it is a technical issue or you have feedback around the specific design of a test kit, each of the Inferno test kits that we host on inferno.healthit.gov has a corresponding code repository in GitHub, and the issues and feedback can be submitted through GitHub that we can consider. So that is one way to send your technical feedback. Additionally, there is also a Inferno channel on chat.fire.org, which provides an alternative means of engaging in discussion around Inferno. And then lastly, if there are questions related specifically to the ONC certification program, such as testing for the G10 criterion, then that can be submitted through the ASTP ONC Health IT feedback and inquiry portal on healthit.gov. And yeah, that's again a place where you can submit questions related to certification program testing specifically. Okay, and then those are the slides that I have, and I figure I can now go through a demonstration of what some of these resources look like online. And so I'll share my screen, and we can see kind of some of these resources online. Okay, so this is the inferno.healthit.gov webpage that I've referenced throughout the presentation. And what this enables is, again, many aspects of Inferno that I talked about. And this is the landing page where there are many available links just to get started. One of the main use cases for Inferno is certification program testing, and this is the link here for our G10 test kit. Additionally, there is also a service that's hosted here regarding validation of fire profiles and resources, and that's available as well for more individual testing rather than individual testing of resources rather than testing a system at large. And then down here, it's again some just kind of overview information around what Inferno is and some information around some of the other pages on this site. So um, just to kind of go over what's available here, the one of the main pages as far as Inferno testing goes are is our test kit page here. And this is really kind of the portal to get to the all the test kits that are available on our hosted instance here. So there's a few features here that I just want to highlight real quick is that you can do a quick search to see if there's a test kit available for your use case. So for example, if I was interested in coverage requirements discovery, DaVinci test, I could type that in. And again, you can see that we do have a test kit available for that. Additionally, the some of the other features we have here are filtering by tags. So again, another way is to see some of the tags here. We can select by that as well. So the and again, if you want to learn more about kind of test kit selection, there's information available through some of these links. And once you can see the test kit that you're interested in, there's a card here to show some of that information, such as when it was last updated, the version, and so forth. Additionally, if you had already done some sessions recently with Inferno testing, that's available as well on the right-hand side here. And yeah, so just to show what a test kit looks like, if we go through the interface here, so this is for our G10 certification. If you select it, you again see some of this information. There's an overview of what is involved with testing here. There are some information again around what exactly goes into testing for the available test kit, and then some additional resources around the test kit that are available. Like if you have issues with the test kit, that can be reported through this link, which would take you to the GitHub repository to where you could submit an issue. Additionally, on the right-hand side here are some of the testing options that are available. So specifically for our G10 test kit, there's different options that can be selected. And so those would be available for selection. And so then if we choose those options, we can create a test session and then go through the interface here for testing a system. And so what's available is for just doing for demonstration purposes, there is the Inferno reference server preset where this will automatically populate a lot of the inputs available. So if you want to just see kind of what Inferno testing could look like with a reference implementation, there can be a preset available for that. And then you can run the tests that are available. For the purposes of time, I won't go through this, but once the tests are, once the tests are run through, there'll be various interfaces for going through those tests. And then once the tests are run, a report can be generated just to describe kind of how the testing results were. Additionally, I'll just also highlight some other additional information that could be of interest. One is specification requirements. And this is interesting in the fact that this maps kind of if we go back to that conceptual framework I referenced at the beginning of the presentation regarding the requirements that are being tested, This, for certain select test kits, there is available these requirements where it maps the kind of use case requirements to specific Inferno tests so that, we include this for transparency purposes so that, we can, again, map the use case to specific Inferno tests. And then again, one last feature I'll highlight in this interface here is sharing sessions. So if you are interested in sharing um, the results of a test session, you can either copy a link or additionally, you could copy a read-only session link. So both of these options are available for those purposes. And so that would be looking at what testing could look like through our webpage here. The some other just things I will note are that if you are interested in learning more about the technical details of the Inferno framework and how to write Inferno tests and deploy Inferno locally, uh, a lot of that information is available through our Inferno framework documentation site. And again, it includes a lot of resources that are available for that kind of information. As you can see over here, information for creating tests, for um, distributing tests, and using test kits. And a lot of the information I went over around using test kits and the interface are available in this page. And then last, I will just again highlight what our GitHub repository looks like for a test kit. So if we go to the G10 test kit GitHub here, you can see kind of what our repository looks like, where it has a bunch of instructions and detailed information around what goes into and what's involved in this Inferno test kit specifically. And again, like for example, including some instructions for how you could run this test kit locally. And if you are interested in a specific release of a test kit, that is also available as well through the GitHub releases feature. And I think that will conclude the demonstration I had there.
Yeah, thanks, Scott. I can take it from here. All right, so we are almost at the top of the hour, so we'd just like to thank everyone for attending today. ASTP will post these slides and the recording on the healthit.gov website in the near future, hopefully next week. If you have further questions, please use the Health IT feedback form to submit your questions, and a member of the ONC Health IT CERT program team will respond to you. Thanks, Jeff. Thanks, Scott. Great presentation today. Thanks everyone for attending. Have a great afternoon.